Alrighty. What's up, guys? Welcome back to the second episode of Boz Family Chiropractic Show. I'm Dr. Randy Thompson. This is Dr. Scott Ahrens and the maestro himself, Dr. Michael Boz. So what are we talking about today, Doc?
Well, we started talking last time about what chiropractic can help with, and we kind of got a little sidetracked. I always go philosophically back to the spine and all that, and that's important, but there's a lot of other things as we're going to touch on today. And then we'll finish up with what you guys can expect, any of you people out there pondering, kicking the tires on trying chiropractic care, what you can expect if you should enter our office for the first time. We're a family practice. We like to get families in here because everyone's got a spine, and we got some good camaraderie here. Me and the boys have a good time practicing. Laughter can be heard all times here. We have a good time getting you people well, so that's what we're going to talk about today. So, without further ado, what would you guys like to add as far as, other than the normal stuff, which you can catch on our last show, that chiropractic might be able to help people with that they're not too familiar with right off the cuff?
So right off the bat, some things that people don't really think about is actually scar formation. So any kind of connective tissue we can treat. So we can treat muscles, we can treat ligaments, we can treat cartilage, we can treat tendons. But after, say, a fall or an injury or a surgical procedure, scar formation can actually start to get a little out of whack. So what your body will naturally do is it wants to lay down more and more and more reinforcement to make sure that that thing is fixed. Whatever injury you got is fixed, and it's stable, and it's not going to move anymore. But unfortunately, what happens is that scar formation is pretty haphazard. It's in all different directions. It's not aligned with the direction and the intent of the tissue that is being healed. So what chiropractors can do is that we can manipulate the tissues in such a way that's going to align the fibers to reinforce the strength of the structure, as opposed to just haphazardly just stabilizing it. Mm-hmm. So we want you to be sturdy, we want you to be stable, but when things are supposed to move, we want them to move as they're designed to. So we use a couple tools for that. So one's our hands, of course. We're going to do some massage, we're going to do some stretching, which is going to help to realign those fibers. But also we do something, we use instrument-assisted soft tissue techniques. So Doc, grab that tool right there. So there's a whole bunch of different tools that we use. So get a good shot of this. Yeah. So this, what's the name of this one? Is this the?
I don't know the exact.
Yeah. So they're all the same. They're all they
have the name grass.
Exactly. So what I can do is I can wear these. Not quite like brass knuckles, but what we're going to do is we're going to dig that in. There's multiple different heads. So this is a bit of a pointier head, which is going to be able to get into those nitty-gritty issues. This is a little bit of a wider base, which is going to be more comfortable than this. But at the same time, if we need this, we need it. This is for broad strokes. We can use this whole thing on much larger tissues to really, grip and kind of get all that gunk off. Think about it like getting the grizzle off of the grill, So we're raking that off. Hopefully you guys enjoyed your Father's Day. Hopefully you guys had some nice burgers and dogs. But if you want to clean off that grill, we're going to do the same way to clean out that scar tissue.
That's a great example.
Cool.
That's literally how it is.
So if you've heard of Graston, that's a very popular technique. That's
kind of the buzzword.
That is a company that certifies people, but they're not the only way to do an instrument-assisted soft tissue technique.
It's a brand name.
Exactly. Yeah. So we use off-brand because we don't want to have to charge you, brand name rates, but you're always going to get brand name care.
Exactly. Right? These things, it's like 5 times, 10 times as much as this. And
I use a butter knife on my wife.
That's what I tell patients. Yeah, I tell patients, if you want to do this in the accessible, like tennis elbow and golfer's elbow, very common.
The different edges are. I was working on a patient last week, weightlifter, with some tennis elbow for the extensors, doing some heavy weights, and he saw one of the little different notches, and he asked, "What is that for?"
Yes.
And I said, "Well, depending on the size of what tendon and ligaments you're working on." He says, "That one looks like it would fit my Achilles. Can I come back next week and get that done?" So patients are starting to understand it too.
They know.
And it's one of those. It's painful, but it's a good pain. So some people are going, "Oh my gosh, that thing he held up to the camera, that looks like a brutal machine." But when you get that release, anyone who's dealing with an adhesion that won't let go or is like Dr. Randy said, just haphazardly laid down, it's not going to allow you the freedom of motion. Your body is smart, but it's dumb. It has that if A, then B kind of approach to just about everything, which is good because yes, the body's intelligent. It'll heal itself. we just kind of, life is fast, and we're moving at life speed. We want to get you guys ready to get back at what you want to do, what you need to do. So, one of our many tools for that, and that covers a lot of. What are the types of conditions that would fall under something that this tool or those type of soft tissue techniques would work on?
I
like
think
as we said,
what you said just sort of makes me think of radiculopathy, neuropathy, because the patient, like you said, the body is so complex. We have so many nerves coming out of the spine, but going to all organs, every cell in the body. But especially when it's going down arms or legs, we understand arm and leg pain, neuropathy. This is a big problem for folks these days, and you need answers. Because the nervous system is what's controlling everything. So when you have that kind of pain, it really affects your lifestyle, your activity levels, what you can and can't do. So
it scares people when they start dropping things like without realizing it, or tripping over things because they just didn't feel it. Like people think, oh, I'm clumsy, I'm a klutz. It's like, no, you might have like a diagnosable medical condition that we can help you fix.
Yes.
Tunnel syndromes. Everybody's familiar with the carpal tunnel. Everybody can point to their carpal tunnel. It's in your wrist, right? But there's 42 other tunnels just in your arm alone. There's so many different nerves that are going through here that if a lot of times when people are reaching forward, or they're driving, their pinkies and the outsides of their palm will start going numb. What's happening is that you're protracting your scapula, you're stretching the three muscles that are going through your triangular interval, and what's going right through there? That's your radial nerve. All of your nerves start from your brain. It goes down your spinal cord, they exit at the vertebral foramen, and they go and they travel through different pathways to get to their target cells. So when you're experiencing things that are going on with your fingers, your hands, your forearms, there's so many different places along the way that it could be coming from. And so that's one of the things that if you're not able to move, if those nerves aren't able to slide and glide easily through those tunnels, they're going to get pinched, they're going to get inflamed, they're going to get painful, and you're going to get symptoms like numbness, weakness, pins and needles, tingling, and we can fix those.
And people understand this because it's actually stopped raining enough recently that you might be able to get out there and wash the car.
Yes.
And then you're pulling that hose and you're trying to get to the front of the car, and it gets kinked around the back tire, and it pinches on that hose, and all of a sudden you don't have water coming out. That's the exact same thing with our nerves. When it's pinched on, then through these tunnels, and it doesn't work right.
Yeah, the body gives us a lot of different ways to tell that something's not correct. We know what normal, everyone knows what's normal, and as Dr. Scott brought up, these nerves are important because they're part of the mix, and as Dr. Randy continued with, and here's another way to look at it, the outside of our bodies, we're all very familiar with where a nose belongs, ears, all that. On the inside, the way we were designed, it's exactly the same as the outside. There's a place for everything, whether it's a conduit, whether it's a blood vessel, a nerve, or what else it might be. It starts somewhere and it ends somewhere. And they all have a function as well as structure, so they fit just nicely. So when we live our lives, get injured, repetitively do things, the list goes on, you tend to get injuries in these places, whether it's a joint, which causes inflammation, scar tissue, lays down aberrantly, doesn't move properly. So these things get disrupted. All this is, and like I had said before, there's a lot of different conditions that fall under this. At the very least, if you are questioning it, either ask us a question on the website or just give us a call. We'd be happy to consult with you. And then, as these guys have said here, we can probably help you. It's worth a shot. Don't live in pain. Don't live with your conditions. Anything else you guys thought of while I've been speaking here that you wanted to add to this?
I think we should tell folks if they are feeling some of these symptoms and they would come in, what would they experience?
Oh, yeah. Next, exactly. And that's how we'd want to kind of wrap it up today is our office, we like to think of ourselves as a little bit, a little more thorough than your average chiropractic office. Everyone practices the way they practice. But we, from the minute you walk in here, we want to kind of get to know you in every way we possibly can. Your lifestyle, your history, personality, what you like to do, in your spare time, obviously what you do for a living, and we get to know our patients. I mean, any chiropractor will tell you, we're a type of counselor, actually, so we get to know our patients pretty intimately and make a lot of friends in the process. So we're here to help, and we genuinely enjoy doing what we do. So when you come in, we want to get some information from you. We've tried to hone our paperwork down so we can get it quickly from you, because that's not fun. But obviously we got to get to know you that way, so we know where you live and how to contact you, how you can contact us. After you fill out your paperwork, one of us doctors here is going to take you back and do our exam. What that usually entails is range of motion. We'll see where where you're, if you can't move one way with your neck or can't turn, and you could a week ago, or it's gradually gotten worse. We're going to look in to see what muscles are being shortened, or what muscles are become flaccid, what muscles have gotten irritated, injured, and maybe laid down scar tissue. So range of motion studies will tell us how well you can move or not. We do some neurological examination, and that depends on if you're having these things that we discussed today. If you're having numbness, if you're having weakness, and again, as Dr. Rainey said too, there's 42 outlet syndromes just in the arm. That doesn't even talk about the leg. So, there's tons of things. All of them are slightly different. You as an individual know your body. You know what's going on with it, and so you know when something's wrong. You come in here, we can pinpoint as to where that wrong issue is occurring. Is it starting at the spine? Is it starting at the hip? Is it starting at the knee? If it's a lower extremity problem. So we'll do a neurological exam. We're probably going to want to take some x-rays of a problem area too. If you have an area that's your number one or your primary concern. What's bothering you the most? And we take x-rays for a number of reasons. We want to see, obviously we want to assess biomechanics of your spine. We want to see if the curvatures are normal in the neck, in the mid-back, or the lower back. And we also want to see if there's any osteoporosis or osteoarthritis forming in you. Okay, so we can tell you kind of where you're at. It also gives us a hint as to how much force we should use if we're adjusting, or what type of technique. There's at least 400 techniques out there, chiropractically, hands-on techniques. I'd like to think we utilize easily 30 or 40 of them in this office. There's some esoteric ones, there's some mainstream ones. We like to use what works.
But we actually use the same ones that orthopedic surgeons would.
You really?
We use the same ones that you're going to see if you go have a much higher copay going to see another doctor.
Exactly.
You're going to get the same exact exam from us. So we do the same things that neurologists do. We're going to look for sensation. We're going to look for reflexes. We're going to look for strength. Those are the three big things when we're checking out your nerves. And so what kind of touch is gone? Is light touch gone versus is more sharp touch gone? So we're going to use a toothpick versus a cotton ball, because there's different types of nerve endings that make you feel different things. The nerve endings that make you feel whether some things are hot or cold is different than the nerve endings that make you feel pressure or light touch. So we need to be very thorough to find not just what kind of different types of feelings are gone, but where that is as well. So all of that's going to give us clues as to what nerves are being affected and where they're being affected and how to treat you. So the same kinds of things that orthopedic surgeons were doing. We're going to look for how your joints are moving. We're going to look for whether or not they're stuck, or if they're too mobile, if they're moving too much. So we can do that for every joint in the body. Another thing, so the only difference is that the certain more invasive tests, dangerous tests, we're going to send you to somebody else who specializes in those very specifically. So if the test is safe to do, we're trained in order to do it. We can read MRIs, we can read nerve conduction studies, we take x-rays here because we can read those, we know what's going on, and we can tell you same day exactly what's going on with your body and give you some peace of mind and understanding of what the next steps are, and whether or not either we're the right doctors for you or we need to send you somewhere else. We're very humble. We're not going to pretend that we can treat something we can't. If there's something that's outside our scope or something that is so advanced that we can't help you anymore, we will send you to the appropriate doctor, a doctor that we trust, that we know is going to get you the right care.
Yeah, that's a very good point there, Doc. And we have quite an extensive referral sheet of neurologists, orthopedists, orthopedic surgeon, neurosurgeons, and just to get, and we're going to correlate care with these people too. So your care doesn't necessarily come and end.
Yeah, we don't just leave you. We don't just say bye. You're somebody else's problem.
Exactly.
We were the ones that that you trusted to come to first. We're going to be able to guide you and ferry you throughout this whole process.
And I think the best part, we have to find out what the problem is, but then treatment so you can feel better.
Exactly.
That's the most important part.
And there's very few things that chiropractic can't at least help with.
And we're one of the few docs that's going to treat you same day.
Yes.
A lot of places they have a little bit more of a sales technique where they'll examine you one day and then give you a report of findings the next day and then treat you the day after that. But now it's been a week and you've been suffering this whole time. If you want to get out of pain fast, this is the place you come to. We're going to take the time to figure out what's wrong with you and to do everything we can to help you understand why we're giving you the treatment that we think is best for you. So if you want answers, we're going to get you some answers. We're going to get you some pain relief fast.
Yes, yeah, we're here for you guys, and we thank you for tuning in again, and we'll be back with you guys in a couple more weeks to take it one step further.
Excellent.
That's great.
Thanks for joining us, guys.